Julie, I'm so glad you're here.
Oh, there's a lot of blood there.
Blood pressure's a little low.
Is he shaking? Hi, I'm Julie from marketing. Normally my day is pretty ordinary, but I have a new obsession. If you're as fascinated as I am by seeing things that are normally off limits, you've come to the right place. There's some things here that are shocking, wild, and completely unexpected. And I'm taking you along for the ride. Bob, hi.
Good morning.
I'm Julie, nice to meet you.
Bob Kerner, welcome to CLI.
Really happy to be here. Thank you for
Happy
having
to
us.
have you. Come on, let's take a look.
All right.
So it's a simulated hospital environment where we focus on clinical preparedness of the people who take care of our patients. This room, for example, is where we do a lot of procedural skills, such as putting in a pacemaker or a chest tube.
Is this the stuff of your nightmares or just mine?
A little bit of both. Okay. Why don't we go take a look at one of our hospital rooms?
Okay.
So we're gonna go in there and say hello to a patient.
Okay.
Hello, how are you?
Oh, hi, good morning.
I'm Bob, I'm one of the nurses here.
Hello, how's it going? My name is James. Is that Julie from marketing?
Yes, it is. How can I help you?
I'm just recovering from a surgery I had a couple of days ago.
So Julie, this is a device called a human patient simulator.
Okay.
And so it's a sophisticated computer, and my colleague James is in the control room and he is portraying the patient.
And he is breathing.
Yes, he is. He's breathing and he's blinking and he has some limited movement. He has pulses. You can feel his
May I touch
pulse
him?
at the wrist, right where you would normally feel your pulse. And he has vital signs up on a monitor here, just like the patients in the hospital have.
I've never seen anything like this. What else does he do? I see him blinking, I see him breathing, he's got a pulse.
So he has all the normal vital functions that you and I have, just in a different looking package. So for example, if you wanted to put these in your ears,
Okay.
James, can I pull down your gown to listen to your breath sounds?
Simply fine.
Okay, excellent. So we interact with the mannequins as if they're real human beings. So if you listen here, you'll be able to hear his breathing.
Like you can really hear it.
Yeah. And then somewhere toward the center of the chest, right around here, you can hear his heartbeat.
That's incredible. It's an actual heartbeat.
Everything can be changed. For example, that's having a heart attack, he changes a thing in the control room, and the type and quality of his heartbeat changes.
So is he just from waist up, waist
Nope,
to shoulders?
he's fully functioning. He has legs, private parts, of course. You can start an IV. You could put a chest tube in case his lung was collapsed.
So I see he has a bunch of holes in his ears and some in his face.
That's how he cries, sneezes, drools, respectively.
What comes out when he sneezes?
Whatever we need it to be. We make all that stuff in-house. It's a whole separate part of how to decorate the mannequin to make it look realistic. Things like vomit and diarrhea.
Wait,
You can
how do you make diarrhea?
very carefully. Usually it's coffee grounds from the Keurig machine outside, again mixed with something sticky, maybe some maple syrup. And then there are even chemicals that you can add to that to make it smell like diarrhea.
Fascinating.
Yes, yes, it's a cool job. It's part educator, right? It's part technologist, and then it's sort of like being a prop master on a Broadway show,
Amazing.
including medications.
Is that real medication?
Come on over, I'll show you. So these are props that look exactly like the medicine that they would have access to in the hospital. When the medication becomes expired, a company buys them.
Oh, there's actual stuff in there.
They take out the drug and they refill it with water.
Sorry
And
to interrupt, but my legs are getting a little cold.
oh, I am so sorry. That's not very service excellent of me.
That's much better.
Excellent. Is there anything else I can do for you?
No, that's okay. Thank you very much.
This is awesome. Let's see what else you've got.
Excellent. We have mannequins that represent patients across the entire lifespan.
Wow, and this is much softer than the adult.
You can't have a baby without having a pregnant mom.
We've met. Bob, why does she look so horrified? Didn't you give her an epidural?
It's a very stressful procedure.
Oh.
And a placenta. You can hold that if you want.
Oh, it's heavy.
Yes, real babies are heavy. You have to be able to manage the weight when it comes out through the birth canal.
Okay. Are we gonna watch our baby born? No? I'm sorry, just, okay. Yeah, okay.
Yep, that's where it comes out.
That doesn't look good. Oh, he's breathing. The student would hear it and then be able to identify
Exactly
it.
right.
Yeah.
This is a trauma man. As you can
Appropriately
tell,
named.
he has no head.
Yep.
So this is a neck. You can see the anatomy of the human trachea there. And why don't you see if you can line it up where you think the urinary bladder might be.
How will I know when I get there?
So you'll know when you see it. Ah, congratulations, you found the bladder.
Wow.
Do you feel up to doing a simulation?
Yes.
Excellent, let's
Yeah.
go give that a try.
Thank you.
Julie from marketing, I need you. Here, put this on.
Julie, I'm so glad you're here. I need you to help me control this guy's bleeding.
around.
He fell off a ladder.
Are you okay?
No, I'm in a lot of pain. My leg is killing me. Please help.
Julie, if you could just put on some gloves, please.
Okay. Oh, there's a lot of blood there.
Yeah, there is.
All right, blood pressure's a little low.
I need you to come over here and hold pressure on this. Can you do that for me?
Oh boy, all right, I'm
All
gonna
right,
check
just
your
hold
pupils
out
now.
nice and tight. We gotta apply a pressure bandage, all right?
Is he
He
shaking?
might be. We gotta cut this.
I have shears.
I know, sir. We're gonna do our best.
3, 2, 1.
Ah, sorry.
Nice and tight.
Okay, I'm sorry. Here, how's this?
I think we need to do a tourniquet. It's still bleeding.
Oh
Can you
boy.
do that
Still
for me?
bleeding a lot.
We're gonna lift up the leg, bring it around. All right, and then you're gonna place it through this buckle here. Pull hard.
Oh, is that how you're tightening it?
Oh, God, this
All right,
feels
and
really
then you're gonna
tight.
twist this around until it's nice and tight.
Oh, that's some medieval shit. Are you serious?
Twist
That's
it,
how
yeah,
you
hard.
tighten it?
Yup. All right, and then it's gonna go on this little notch right there. We stop the bleeding.
I feel really dizzy.
He's lost a lot of blood.
Great job, Julie.
Yeah.
I think he's
Saved
gonna be
you.
okay, sir. You're gonna be okay, all right?
Thank you. Thank you so much.
Ready for us to
All
transport.
right. Julie, you grab the IV pole. We'll get him out of here.
Okay, ready?
You're gonna be okay, sir.
Oh, he's got other issues. I didn't see that.
All right, let's get him out of here.
I am so appreciative of Julie from marketing for saving my life today. If you found this tour of CLI as fascinating as she did, join us to see where we go next. Make sure you like and subscribe to The Well by Northwell.